So now I want to introduce David Fukuzawa, who's the facilitator of the next session on treatment challenges and obesity therapy.
Well, good afternoon. As Chris said, my name is David Fukuzawa. I'm a member of the Roundtable, and I am the Managing Director for Health and Human Services at the Kresge Foundation, which is a national foundation. We are at the ampersand in today's program. So we've been obviously talking a lot about prevention. We're going to talk about treatment. And you know, in a conversation, I was trying to keep track of the words here, and if we were to do a word cloud kind of analysis, you know, certainly there would be a big bubble around equity. I think there was also going to be a pretty strong bubble around social determinants and prevention, obviously. And I think, rightly so, the broader conversation today has been about just how do we get ahead of, you know, this epidemic? How do we turn it around? Because we're not going to get there, surely, by just treating ourselves out of it. It's gotten beyond sort of that. So why are we talking about treatment? Well, certainly, as certainly the Roundtable has discovered, you know, in its many discussions, the disease of obesity and its related issues, the metabolic diseases, cardiovascular disease, et cetera, is really not just a very complex disease with many different kinds of factors and causes to it. It may be, in fact, a complexity of different diseases, in talking to people about what this is. And certainly the treatment of severe obesity is something entirely different that can't simply be treated by just better nutrition and better physical activity. It is something that goes beyond those kinds of things. So there's that particular question in the whole treatment issue around obesity that we sort of have to keep in mind and be aware of. And there is also the question then, given what we know about the many different factors around obesity and the prevention and management of it, how do we connect, you know, the providers, the physicians, and other professionals that are really entrusted to serve this population of people that are either suffering from obesity or at risk of suffering from obesity? How do we connect it with everything else that's going on? You know, can we get to a much more integrated sort of view of this? And that's where our panel is going to help us with. And on today's panel, I have Dr. Carol Apovian, who is from Boston University, professor of pediatrics and medicine. And Don Bradley, who is a member of the Roundtable, and the Associate Consulting Professor of Community and Family Medicine at Duke University, just retired from Blue Cross Blue Shield of North Carolina, and so a recovering healthcare executive. And I will also be sitting as part of this panel to talk about sort of the community dimension. So Carolyn is going to talk a little bit about the sort of the treatment aspects of this and give us a sense of where we are in terms of the state of treatment today. And Don is going to talk about education payment issues, I believe. But to begin, to sort of do some level setting, we thought it would be useful as part of this panel to give you a sense of just what it is we're up against if we just simply give you kind of the raw numbers of both kind of the, if you will, the supply on the treatment side and then the demand or the potential demand on the treatment side. So the first slide that we have will show you over the course of 5-6 years the number of board-certified physicians in obesity medicine. And you can see there's been a pretty dramatic increase, going all the way from about 400 to 1,600. So, you know, that's a 400% increase in the number of folks that are getting certified. And you may think that, that's a significant increase, in which it is, but if we go to the next slide, the data we have is over 17.5 million adults with severe obesity. So at the current levels of current board-certified physicians, we would have, each diplomat would have to serve approximately 11,000 patients. So that's an enormous increase. And if we were to broaden the discussion, well, what about just sort of the primary care workforce? And if we were to include family practitioners, folks in general practice, et cetera, and just looking at the numbers here. So if we were looking at the really severe obese, at the BMI greater than 40, we were talking about 90 people or patients per practitioner. And that's obviously a conservative kind of estimate in terms of the need in this population. And going down to a BMI of 30 or more, then we're talking about over 400 people per practitioner in terms of the number of people that we would have to, those doctors would have to treat. So you can sort of see in terms of the numbers that we face an enormous challenge just simply on the treatment side of this, the clinical side of this. So what about the sort of patient self-management and the sort of programs that help with patients help manage their disease? So probably the best known program that we have is the YMCA's Diabetes Prevention Program, DPP. And you can see here from this slide again, a dramatic increase in the number of participants served, going all the way from a little over 500 in 2010, up to almost 13,000 in 2015. But again, if we were to talk about what the real demand is on this particular issue, we have 86 million adults that have prediabetes, in other words, candidates for this program. So 220 DPP programs in 2015 with an average of 57 participants. To scale up to the level that we need, we're talking about approximately 1.5 million DPP programs. So that's like an 11,000% increase to meet the demand. So clearly what that compels us to think about then is prevention. But then what do we say then about treatment? And so the next slide, which is some of you from the roundtable may have recognized, or if you read an article about a year ago in Health Affairs, there was an article which members actually of the Innovation Collaborative on the roundtable around integrating community clinic systems for the prevention and management of obesity, produced an article which proposed a model. And if you will, sort of the left-hand side of it is really thinking about, so what is the care delivery part of this, which is, the practice and the care delivery systems, payments, et cetera, that are around the sort of the management and prevention of obesity. And then if you think of programs like DPP as part of the patient self-management, self-care, the community engagement part of this. And the whole previous part of our today's discussion has really been about sort of these community efforts that have been going on. How do we connect all of these? And so that blue arrow at the bottom, or the middle there, is really about the pieces around integration that pull these together. And it's everything from structural ways of integrating this to the kinds of people and personnel and policies that pull all of this stuff together. And so what we're going to try to have today is a discussion which sort of moves from left to right, if you will. And so we're going to start with Carolyn.